Can you please introduce yourself and tell me what year intern you are at Mafikeng Provincial Hospital?
My name is Dr. Chivenge Charity, and I'm currently doing my first year of internship.
Awesome.
I'm Nolwazi Kubekulu. I'm doing my second year of internship and I'm finishing very soon, so I'm very excited about that.
My name is Dr. Tandera Ngobo. Almost at the end of my second year internship.
Awesome.
Okay. My name is Barbara Serumagazaki. I'm doing my first year internship.
Awesome. So thank you for being a part of our conversation. It's for an initiative called Young MDB The Change. And essentially we are challenging the junior doctors of our generation to not be victims of a challenging healthcare system, but pioneers of its transformation. We're obviously here to help you create an orientation tool for Mafikeng Provincial Hospital. And so I'm going to start by asking you a few questions about what it's been like to be an intern here. So can you share with me what has been challenging for you as an intern at Mafikeng?
Okay. Since I came here, I didn't have an orientation, a proper orientation. So my first day in casualty, I didn't even know where casualty was. So I had to go ask around. Then I went to casualty. Then I didn't even know where the syringes, the needles were. So it was quite challenging for me. But as I got used to it, I managed to cope. Yes.
I'm going to ask you guys different questions just to get different experiences. To you, I'd like to ask, what were your expectations when you came to Mafikeng as an intern?
Honestly, I had no idea what to expect because first of all, I had no idea where Mafikeng is. I was second rounded and randomly placed. So when I came here to Mafikeng, I was still anxious about the place, or what language do people speak, what's the type of people around, and the patients that I'll be helping. So I was anxious, obviously about internship in general, but I didn't have a specific idea of how it would be.
Okay, cool. I want to ask you, what has been the hardest moment for you being an intern in Mafikeng?
I think the hardest moment for me here as an intern in Mafikeng was during the strike, when we had to work with a skeleton staff, if I might say, where we had to put in extra work, sometimes extra hours. And around that time, so unfortunately, we lost some patients unnecessarily. That was tough for me. It was heartbreaking. It was difficult, but we had to do what we could do to, be there for those patients that we could still provide healthcare for, and unfortunately for those that we could not really help up to standard. It was painful, but we did. We got through.
This question I'm going to pose to you. I know you've been here a short while, but do you think orientation matters?
Absolutely. I think it helps prepare you. I mean, it makes you feel a lot more comfortable, I think, as a doctor, if you know where to go around, even for help and to access things that you need to attend to patients.
Sure.
Absolutely, orientation is important.
Then I'm going to ask you guys each the same question. The first question I'm going to ask you is, what valuable lesson will you take away from working at Mafikeng?
This is quite a nice place. It has nice people. So if you want to work at Mafikeng, you better be nice.
Okay, cool. For you, what's one valuable lesson that you will take away from your 2 years of internship?
Definitely learn to be confident. As most times I was expected actually to pull up my pants. I was expected to grow from a student's mindset to an adult independent mindset. So I've learned how to be confident and to stand up to for my patients. Yeah.
One valuable lesson for you?
Is it teamwork or is the best thing ever? I mean, sometimes when working together with the nurses, your patients as well, and your seniors, it's important. For me, I think it made a lot of a difference working here, or knowing that you have a team where you need help, there's people you can go to, and also just involving your patients in terms of management, it makes a whole lot of a difference. So teamwork and collaboration, I'll take that lesson.
And one valuable lesson that you'll take so far?
I think I have more than one, but I think it would be to remember the reason why you decided to be a doctor, which is to treat patients. You know, Mafikeng is a small town. There isn't a lot of stuff to do here, but I think as long as you remember the main reason why I became a doctor was to treat patients and to take care of people, then you'll be fine.
Sure. Then I'm going to ask you, our slogan for our organization, Young MD, is Dare to be Great. What has it looked like for you to dare to be great in Mafikeng on a daily basis?
Okay, as for me, I think I have to be focused and I have to be committed to my work. I don't need anybody to tell me to do something because I'm responsible for my patients. So I think I have to be responsible. Yes.
For me, it means that I also have to always upskill myself for the betterment of patients. So because I'm a junior doctor, I'm still learning along the way. So I want to give my patients the best that I can. Yeah.
Awesome. What is daring to be great to you?
For me, daring to be great means me showing up at work every morning with a new attitude and giving it my best despite the challenges that happened the previous day, despite me having left work the previous day saying I don't want to go back to that ward anymore. But waking up each morning, presenting myself there, and I know I'm ready to give my best and remaining calm no matter what the situation is.
Sure. And what does daring to be great look like to you?
I think I'm going to say something quite similar to what my colleagues have said, but I think it's to always remain updated as a doctor, to go the extra mile for your patient and to try and imagine, what it's like to be there as well. Try to put yourself in your patient's shoes.
Awesome. Another question before I wrap up is, how have you learned to take care of yourself while you've been here?
Okay, as for me, I'm used to being alone, especially from the varsity. So, yeah, I'm quite confident about being alone and being myself. So I know how to take care of myself since from the university.
Do extra activities on weekends when you're not on call. Go out, play, go treat yourself. Every payday I go to Protea Hotel or Magan Bean or watch a movie. I do something nice, so just to distress as well. Yeah.
Well, for me, I think every day I put myself first. Well, that's after work, of course. But it's I've made friends with my colleagues, with my housemates, and then I've also found family. I go to church a lot, so I found family at church. So I have brothers and sisters there. So, and I tend to do what makes me happy. I love reading and I love eating. So I don't mind going out alone and just sitting at a table and just having dinner alone. So I just make sure that I'm happy, and if I need to relax, I take time out to relax.
Awesome. And for you?
I think it's just talking with colleagues, I guess, about patients and experiences. I think, basically things like that. And also taking time out for yourself.
My last question to you guys, I want you to answer in 3 parts. So the question is, what is your hope for Mafikeng Provincial Hospital? What's your hope for South African healthcare? And what's your hope for yourself?
Okay, I hope for the best, especially for this hospital, most especially for my patients, and I wish they could be provided with enough medications and everything that they need. And as for the hope for myself, I hope to be a great doctor, and I only have a 2-year contract here. So as I go to other hospitals, I wish to be that best doctor, depending on the training that I got from here. Thank you.
My hope for this hospital, basically, I just wish everyone would get the good health care. I wish that we would treat every single patient as if they are our own relatives. And then with regards to for South Africa, I hope that South Africa would actually focus on health a bit more than they are. Through education, through other fields, and also not having a lot of shortage of drugs and all of those things that set patients back. Because then if we also focus on our education within the patients, they'll understand their drug treatments, they'll understand why they need to adhere in terms of treatment. So I hope we also just focus on the other aspects of patients, not just give patients medication, but also try to educate them in all of those. And then as for myself in the future, I definitely wish to specialize, and I hope I remain humble. I hope that I give my best at all times, irregardless of what's happening, of my mood, of how I feel, of my circumstances. I just hope that I give the best that I can.
My hope for Mafikeng Provincial Hospital, I hope maybe next year we get more senior doctors, because I feel like we need them a lot, because we here as interns, but if we do not have a proper guidance, we might, fail along the way. So I just hope the more consultants or senior medical officers would be interested in coming to join Mafikeng Hospital. And my hope for the South African medical healthcare, I feel that they are trying to do as much as they can, but it's still not enough. Maybe, my hope is that maybe they just step down to community level and try to reach people at that level, instead of trying to implement or make decisions without actually involving the people that will be affected by those decisions. By that I mean the communities, those who are still at school, the medical students, and everyone else who's going to join the medical field. And hope for myself, and then I also hope to specialize in my favorite specialty. I'm not going to tell you though. But I hope to do that after ComServe. And also I hope that I never lose passion for medicine, that I always remember why I wanted to be a doctor in the first place, and not just get excited because of the prefix, Dr. Ngobo there, but I also just remember always, Ruti, why did I want to become a doctor, and just never lose that passion no matter what happens. But yeah.
All right.
Okay. So I think a hope for Mafikeng Provincial Hospital is more facilities, more staff, more senior doctors, like my colleague said. I think also my hope for healthcare in South Africa is, I guess, more focus on your rural areas. I think a lot of the hospitals in the big cities are kind of well taken care of, and I think there's quite a bit of neglect when it comes to rural hospitals. So that would be nice if there was more focus on those areas as well. And then in terms of myself, I hope to become a great doctor, but not a great doctor in the sense of becoming more wealthier or driving Mercedes-Benzes and all of that stuff. No, but to become a doctor that is that takes care of their patients, that is humble, that is always cognizant of their patients and what the experience is.
Well, I want to honor you all for being a part of this moment. I really hope that you can join the call and the cause to dare to be great. Thank you for choosing to stay in Mafikeng Provincial Hospital and showing up to this space every day. It's definitely not an easy space to work in. It's definitely challenging. But it's so good to know that there are people who come to this space and give up their best daily. I hope you can take the cause and the slogan "Dare to be Great" and apply it not just into your clinical practice, but into your everyday lives. So thank you.